want the foot, the natural rest position of the foot is almost full plantar flexion. So for these joint mobilizations, you want open packed position, which is about 20 degrees of plantar flexion. So you can sort of eyeball her up to neutral, and then slightly plantar flexed is where you want her to be for these mobs. So I'm now going to put my web space right over the talus, and for talocrural distraction, I'm pushing the talus along, distally, basically toward the wall, toward the windows that are in front of us. Okay, so my force is in that direction. All right, so that's talocrural distraction. It's a little awkward because your arm is kind of doing this, right? Another way to do it is to just come in like this with your fifth fingers over the talus and then distract the talus that way. But for that, you might have to strap down the tibia with a belt. So you can, the idea here is to pull the talus out of the mortise in the direction of the plantar surface of the foot. So it can be this way, okay, or it can be that way. In either case, my force was in that direction. And then for subtalar distraction, that's a little bit easier because now you just grab the calcaneus and you just pull the calcaneus plantar that way, okay? Just pull the calcaneus. That's for subtalar motion, which is inversion, eversion, or to decrease pain, okay? So those are the distractions. For posterior glide of the talus, the position is pretty much the same hand setup as you used for distraction, but rather than distracting that way, instead what you're going to do for posterior glide is just push the talus posteriorly. Just glide the talus posteriorly like that. Okay, straight down to the floor in this case. Okay? And that's to increase dorsiflexion range of motion. The other mobilization to increase dorsiflexion is stabilizing the medial side of the ankle and doing a posterior glide of the distal fibula, just like that, okay? So you just stabilize medially with however your hand best seems to fit in there, and then get your thenar eminence on the lateral malleolus and do posterior, oops, sorry, Sandeep, crunched your tendons. Okay, push posteriorly on the fibula, okay, the lateral malleolus. The idea there is that you're sort of wiggling and spreading the mortise a little bit so that during dorsiflexion, the talus can roll into the mortise more freely, all right? It's also the idea, sometimes with lateral ankle sprains, the fibula gets drawn forward from scar tissue and tightening, so you're sort of pushing it back to where it belongs. Okay, that's the other idea for that one. Okay? That's to increase dorsiflexion as well. Go prone. Okay. So for prone, you're going to do an anterior talar glide to increase plantar flexion, but this one is indirect because you do go through the calcaneus. So you're pushing the Sandeep, slide down 1 inch. So even though I'm really pushing the calcaneus anteriorly, the reason that I'm doing that is because I actually want to glide the talus anteriorly. Well, I really can't get my hand on the posterior talus, but I can get my hand on the posterior calcaneus and glide it anteriorly. Okay, straight down to the floor. Now the patient's prone, and that would be the glide to increase plantar flexion. Other glides in prone are subtalar lateral glide, which is pushing the calcaneus in the lateral direction. Subtalar lateral glide. Okay. Actually, Sandeep, why don't you just bend that knee? Okay. So subtalar lateral glide to increase inversion. Subtalar medial glide, you just have to turn yourself around and now grasp the calcaneus in, you know, a nice open packed position, just sort of some slight plantar flexion, sort of neutral subtalar joint, and then just push medially, okay, for inversion. Medial glide for, I'm sorry, eversion. Medial glide is for eversion, to increase eversion. lateral glide is to increase inversion. Okay? All right, so that's it for the